Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Upstate Medical University teamed up with the Syracuse City School District to provide accessible, culturally competent behavioral and mental health services that support the academic success and well-being of students and families in the district. Here to tell us about the program and how it's going is Dr. James Demer. He's a child and adolescent psychiatrist at Upstate. Welcome to the Informed Patient, Dr. Demer.
Thank you. It's great to be here.
How does this program work?
Yeah, so this program has actually been several years in the making. It's an initiative out of the president's office of Upstate, Dr. Dewan. He and the leadership in the Syracuse City School District, along with a vice president named Dr. Mbuke, they've been teaming up and planning for probably 5 or 6 years as to a way to kind of marry the expertise of Upstate Medical University and the needs of the children and families of the Syracuse City School District. So they were able to obtain a pretty sizable grant, which has since been kind of modified. And so the way in which it's funded has changed a little bit, but it was born out of Dr. Dewan's vision, seeing the need of the families and children within the Syracuse City School District and wanting to do something about it, wanting to do something that would provide a quality care and provide access to the children and families who live within Syracuse City.
So which of the city schools have a clinical site?
Yeah, so currently we're in 3 schools. So one school is called McCarthy at Baird, which essentially is a school for youth who have more severe emotional needs or developmental needs. The second school is Dr. King, which is younger elementary school. And the third school is Grant Middle School. So we're currently in those 3 schools with the hopes to add 2 to 3 schools every year to eventually get up to a total of 11 schools within the Syracuse City School District.
So would mental health services be available just during school hours?
Yeah, so we make ourselves available during school hours, and we also offer extended hours. So we're trying to kind of meet families and children where they're at. More or less, we extend to 6 p.m. if needed, and then we're also available during the daytime as well.
Now, I know you mentioned a grant, but does the school district or the family pay for the services?
Yeah, so it goes through their regular insurance. So whatever type of insurance they have is billed for it. And so from that standpoint, in that way, it almost functions like an outpatient clinic model.
Now, how do students or families gain access to the services? Does a teacher need to refer them, or can anyone just make a request on their own?
Yeah, so one of the things we've tried to do from the onset is try to integrate and collaborate with the existing structure within each school. And so each school social worker at this point, through referrals from teachers or from parents, the school social workers fill out an application, and then our intake coordinator contacts the family and gets things going and then assigns the case to one of our therapists. So we have a number of therapists. Each one is a social worker, and each one has a specialty. So we have one therapist who's specializes in family work. We have another social worker who specializes in working with the staff or the milieu to help bolster the mental wellness of the teachers and staff within each school. We also will be hiring a senior social worker who will start a program, an educational program for some of the undergraduate students in local colleges who are looking for clinical experiences, as well as a psychologist, a doctorate level psychologist who will serve to provide training for some of the local doctorate students and psychologists in the community. So kind of have a diversity of lots of different services that we're offering directly to the family and the children, as well as some services we offer as far as training opportunities.
I definitely want to hear more about that. But first, what does culturally competent mean?
Yeah, that's a good question. So I think that means different things to different people. So I'll give you my definition. So to me, the first thing it is an awareness that each person that we see has a distinct history and their own individual present that's different than the person doing the evaluation. Um, the second thing is has to be a curiosity in another person to learn more about the other person's history and perspective, and then the ability to kind of acquire knowledge as to what that person's individual history means to them and how it influences their current life. And it's something that's ongoing and individual to each person that we see. So I guess it requires kind of an attitude of humility in a sense that we're more learners than we are teachers initially, that we're kind of all ears wanting to learn as much as we can about the current circumstances of the person, as well as their past history, going back multiple generations. That's the way that I view the cultural competency.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Upstate child and adolescent psychiatrist James Demer about the comprehensive school-based mental health program involving Upstate Medical University and the Syracuse City School District. Now, you mentioned that the therapists have kind of areas of specialization. What are the kinds of issues that are coming up most commonly, and how are they being dealt with?
Yeah, so wide range of issues, everything from attention deficit disorder, where the school or the parent has noticed some issues with maintaining attention and focus to a degree where it's impacting the child's ability to be successful in school, all the way to issues that in some way are a result of trauma or traumatic experiences. So one of the things that we've noticed, and maybe just in the general population, but more so within our population we're serving, is that a lot of the children and families have had a number of adversities that they've had to overcome. Some of those are ongoing stressors in terms of housing insecurity or issues with finances. Some of those have to do with abuse or neglect or traumatic experiences that have happened to the child or to family members that have then impacted their ability to relate to the child. We also do see children who struggle more with externalizing symptoms like aggression, physical aggression, or aggression directed towards themselves in the form of self-injury. So there's a wide range of presentations, also to include obviously depression, anxiety, things like that. So those are the sorts of things that we've seen so far.
Do you ever consult with their primary care physician for medication, like prescriptions?
One of the nice things about our program is we have a care manager and we have a non-clinical social worker whose role is to help us to connect and get collaterals and information. We also do have myself and a psychiatric nurse practitioner that can do the prescribing as well. So that one of the nice things is we can kind of have a comprehensive team where we have a therapist doing individual work, a therapist providing family work, the therapist, offering training to the milieu, as well as myself or psychiatric practitioner doing a medication consultation. Sometimes the family will wish to continue with their primary care because they have relationships there. Other times the primary care will tell us, that they'd welcome us taking over the medications. But definitely we try to connect with their pediatrician or family practitioner because some of them have longstanding relationships with them that we want to respect.
Can you talk to me about how the program is creating pathways for diverse, credentialed mental health professionals?
Sure. So one of the things Dr. Mbuke did is he's the vice president at Upstate, and he deliberately reached out to people he's known over the years with diverse backgrounds. So one of the ideas is that eventually we want to offer training and opportunities to people within the Syracuse City School District, people who maybe graduated from the Syracuse City School District or went to university or colleges locally here, and try to provide opportunities for them that invite them to stay in the community so that the children and the families are are working with people who had similar life experiences, similar backgrounds. That's one of the things that is really important to this program is we want it to be a program that sustains itself. People who have an investment in the community, an investment in these schools. That's been done deliberately. There are a number of clinicians we have who graduated from the Syracuse City School District, like 20 years ago. That's been something that's been done intentionally to try to create kind of that sense of extended community.
Well, I understand this is a program that will be phased in over 5 years. What is planned for the next 4 years?
So the plan is to add more schools, also to add more training. As I mentioned earlier, we are hiring and continue to hire psychologists and social workers who've had a lot of experience who will then provide training sites for graduate students in social work, for graduate students and postdoctoral candidates in psychology. We're also looking to bring in psychiatric residents and even pediatric residents from upstate to rotate with us to expand those training opportunities for them. We also really want to focus on providing a quality of care that is a little bit different than maybe they'd get even in outpatient clinics. For instance, our ability to observe children in the classrooms and meet with teachers on site and speak directly to school administrators and kind of integrate ourselves into a given school's community. And we're hoping that that will provide a thoughtfulness and a quality of care that continues to improve over time. But I think part of it is continuing to provide care to more students over the next 5 years, but also continuing to improve the quality of care in which we're delivering.
How will you measure success of this program?
Each person who has leadership in the program has different things that they're looking for. The thing that I think that I'm focusing on is there's recently been done a study out of Johns Hopkins that looked at something called positive childhood experiences. So you folks may have heard of something called ACEs, which are adverse childhood experiences, which have been found to contribute later on to adult medical illness as well as mental health illnesses. So these positive childhood experiences are something we're trying to foster in our population. And so our plan is potentially over time to measure how many of these experiences we can introduce in each child's life. So there are 7 different positive childhood experiences that we hope to increase the number in each child's life who we provide services to. So for example, one would be the child feeling welcomed in their school. So it's been found that adults later on who are asked, did you feel welcomed in your school? Those adults who felt welcomed end up being healthier from a mental health standpoint as adults. Another one of them would be something like feeling supported by more than 2 adults in their community outside of their immediate family. So one of the things we hope to do in collaboration with different mentoring programs and programs within Syracuse is to kind of be deliberate about trying to expand kind of the village that supports certain children. And a number of the other ones have to do with feeling heard and safe within the family system. So that's where one of the things that we really want to focus on is the children feeling a sense of being heard and being cared for within their family system. So that's one of the things that we're kind of looking at is trying to increase the number of positive childhood experiences that children who enter our program are eventually exposed to, with the idea being that adults who have more of these PCEs end up being healthier adults. That's one of our initial ways that we're going to try to measure it. But other folks are looking at graduation rates. In some of our schools, we're looking for trying to reduce number of incidents within the school. I think that'll be an evolving sort of thing where we'll find different things that we'll use to measure success over time. I think one of the things Dr. Dewan ultimately wants is he wants to see more applicants to Upstate Medical University, youth who graduated from the Syracuse City School District. So, and I know that's one you look at years and years down the road, but when I met with him, he basically said, the measure of success is 10 years from now, when I look at applicants to Upstate Medical University, I want to see more coming from our neighborhoods. And that's a taller order. Obviously, it might take more time, but I think that, for instance, would be his definition of success, perhaps.
Well, this is all very hopeful, and I appreciate you making time to tell us about it, Dr. Demer.
Oh, thank you very much for having me.
My guest has been Dr. James Demer. He's a child and adolescent psychiatrist at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.